The World Health Organization has declared the Americas the new epicenter of the COVID-19 pandemic, as Brazil reported over 1,000 deaths in the past day. The U.S. has recorded 657 new deaths, raising the total to nearly 99,000. The global COVID-19 death toll has crossed 350,000, with nearly 5.6 million infections. This report has more.
World Health Organization's Director for Americas, Carissa Atin, says the lockdown restrictions should not be eased as the region has over 2.4 million cases so far. In terms of total cases and deaths, Brazil is by far the most affected country in South America. But in terms of deaths per million people, Ecuador is worst affected. But as daily death count shrinks in US, many states, including California, have begun to reopen their economies after months of lockdown restrictions.
I'll remind you, we have statewide guidance modifications, and we have these variances, these regional variances, which have self-attestations, people basically attesting at the county level, local elected officials and health officials attesting at the local level that they have containment plans and they have plans to protect their citizens from the spread of this virus.
While many countries have begun to ease lockdown restrictions, governments are focusing to produce COVID-19 vaccine at the latest. The UK has announced to provide antiviral drug remdesivir to certain COVID-19 patients, as clinical trials showed it could shorten the recovery time.
Today I can announce that we're beginning a new trial for selected NHS patients of an antiviral drug called remdesivir. There have already been some promising early results on coronavirus patients, with early data suggesting it can shorten recovery time by around 4 days. As you can understand, we'll be prioritising the use of this treatment where it will provide the greatest benefit.
Meanwhile, Saudi Arabia has announced to resume domestic flight operations from May 31st. Kingdom's Ministry of Human Resources says public sector worker will eventually resume work as normal as of June 14.